today resource is Planned Parenthood Federation of America Incorporated, and this is Emily Gothier. This is the resource that I researched. There are a full range of services that Planned Parenthood actually provides for. It's primarily known for abortion, but there are a list. Planned Parenthood actually provides for many different services. Abortion is just a small portion of what they do. Some of the other services they provide are birth control, there are general health care services, there's LGBT services, but the most important thing I want to note here is that Planned Parenthood doesn't only provide for women, it also provides for men. And men's health services, and such as STD testing or treatment or vaccines, or condoms, or any other birth control for both men and women. This is an interesting topic. A lot of people think that the government supports Planned Parenthood. But actually, Planned Parenthood is not funded by the government. It's funded by Medicaid, which provides income for low-income families or low-income individuals, and it provides them access to birth control and screenings, which I'll explain in the picture next to on the right. It also provides funding is also made by Planned Parenthood for Title X, which is a family planning bill. And funding is also provided by private grants and donations. So the picture on the right that I provided is a really cool example of a person named Casey who goes in to get preventative care. They go in and they get birth control or STD testing or a pap smear, things that we would see our primary care doctor for. And maybe Casey, this individual, doesn't have primary care or doesn't have a doctor or access to insurance, which I'll get to later. So then the individual, let's say Casey gets these services, then she submits a claim to Medicaid, just like you would any other insurance, and then Medicaid reimburses for Planned Parenthood. So there is a lot of topics about defunding Planned Parenthood, which I'll get into later, but it's not funded by the government. It's mainly funded by Medicaid and Title X, but there are also private grants and donations that also occur. So there are multiple branches of Planned Parenthood. Planned Parenthood itself was formed in 1916, but this picture on the right, the term birth control was actually first created in 1914, before Planned Parenthood was even an organization. There's also the Planned Parenthood Action Fund and the Planned Parenthood Global, which provides Planned Parenthood type services internationally, because Planned Parenthood itself is a domestic service in the United States. But for 45 years, it's also been providing in other countries. So who does Planned Parenthood serve? It mainly serves people that want to be sexually active or who are sexually active. And as I mentioned before, it's people who don't necessarily have a primary care provider and they need reproductive health care. Especially people who are low income or don't have insurance, this is a great resource to use. Again, it's not just for abortions. Abortions are a very small portion of Planned Parenthood. So this is what I mentioned before about the defunding Planned Parenthood. So this is also a really good graphic of what would happen if they use the term defunding Planned Parenthood, but you can't really defund it because it's not a government. It's not supported 100% by the government. It's not funded by the government, so you can't just cancel it like our cancel culture. But a lot of it is based off of Roe versus Wade, which I feel like a lot of us have heard a lot on, especially in the past year. So this was created in 1973. It legalized abortion, but in the last year, especially in Texas, there's been a Senate Bill 8, which has been trying to cancel or make abortion illegal for 6 weeks gestation, which most of the time women do not know that they are pregnant at 6 weeks. That's one missed period, if anything. So it makes it illegal. It make it that you could go to jail, or if you know someone who does this, who wants to get an abortion, could go to jail for this. And that's what all the controversy was about last year. It's still, I think, occurring, but it mainly occurred last year. But this graphic provides a good summary of what would happen if we didn't have Planned Parenthood services. There would be more unplanned pregnancies, and it really goes with the cycle of poverty and low income. Another thing I want to mention is really what I believe in researching this is that if we took away Planned Parenthood, we'd still have abortions. They would not be as safe, and it's not, this organization, this resource is not just abortions. It's a very small portion. Really, it's making sure you have preventative care. And birth control and access to birth control is healthcare. These are the locations and the contact information. So I found the main organization is plannedparenthood.org, and you can access that if you wanted to make an appointment. But we also have Planned Parenthood in Wisconsin, and this main headquarters is located in Milwaukee. But we also have one locally that's about, I would say, 10 minutes from the Fox Valley Tech, and it's in Appleton, and it's off of Wisconsin Avenue. Again, some of the clinics, I think the one in Appleton does not perform abortions, but they still provide all the services for reproductive health care and just health care. No one needs a referral to go to Planned Parenthood, which is super important. It's a walk-in clinic. People can come in. If they have availability for the same day, you can be seen that day. You can also pick up your prescriptions, and you don't need insurance to be seen. There are lower fees if you don't have insurance, and again, that kind of ties into the Medicaid and the Title X, where the funding comes from, to support people, because I think it becomes a big cycle, and if we don't have access to preventative health care and more care, we have more of the cycle of early pregnancy, and it just keeps repeating itself. And this is just a very good resource to provide for healthcare, which reproductive care is healthcare. And then these are the references I had. I think this is a really good graphic as well that talks about women's health, but really this isn't just women's health, it's also men's health. This reproductive care, because they go hand in hand. And I learned a lot from this organization, and I think it's a really good community resource to refer our patients to if they need it.